Hello and welcome. Today, we're diving deep into the foundations of diagnostic microscopy in parasitology. We're going to cover the essential techniques, the keys to identification and diagnostic accuracy, and really explore why visual expertise and interpretive skill are just so critical in this field. Okay, let's start with a number that might surprise you. A full 70% of parasitic infections are diagnosed simply by looking, through direct visualization. It's not about complex chemistry, it's about what you can see and interpret with your own eyes. And that requires a very specific skill set. First, there's morphological identification. That's recognizing the unique shape and structure of a parasite. Then you need developmental stage recognition. Are you looking at an egg, a larva, or something else? This tells you so much about the infection. Next is motility assessment. Sometimes the way a parasite moves is the biggest clue to its identity. And finally, structural analysis, getting up close and personal with its internal and external details. Now here's the critical insight. Unlike microbiology where you might grow cultures, parasitology is all about human interpretive skill. It comes down to the analyst's trained eye. And that leads us to the golden rule, and it's an absolute one. Poor microscopy leads to misdiagnosis. There's really no gray area there.
Here it is, the whole workflow laid out. It's a carefully designed algorithm to increase our sensitivity at every single stage. It all kicks off with specimen reception, followed by a macroscopic exam. From there, we prepare a direct wet mount. Then, we might use concentration techniques, apply a stain to make things clearer, take precise measurements for confirmation, and finally issue the report. But you see that arrow at the bottom? That's the key takeaway here. Every single step incrementally improves our diagnostic sensitivity. You can't just jump ahead because each step builds on the one before it.
Okay, let's zoom in on that very first step, the macroscopic examination, or what we call the naked eye check. Before a microscope even enters the picture, we're looking for clues in the sample's matrix. What does the color tell us? Black could mean old blood. A watery consistency might point towards protozoa. Greenish mucoid samples, maybe amoebiasis. And of course, visible blood can be a sign of dysentery. We're also on the lookout for visible parasites themselves, things like ascaris or tapeworm segments. And the rule is clear. If you see them, they must be collected separately for identification. Next up is the direct wet mount examination, and this is a crucial two-part process. On one side, you have the saline mount. It uses a physiological saline solution, which is just perfect for preserving the parasite's motility, seeing it move. Spotting a motile trophozoate is a direct confirmation of an active infection. But, and this is a big but, if that motility is lost, you risk a false negative. On the other side, we have the iodine mount. Now, iodine actually kills the parasites, but in the process, it beautifully enhances their internal morphology, especially the nuclei. So you can see why you need both, right? The saline mount shows you if it's alive and moving. The iodine mount shows you the fine details for identification. The mandatory protocol is simple. Every single specimen gets both mounts, no exceptions. So, you've made the perfect slide. How do you actually examine it? Well, you can't just wander around the slide hoping to get lucky. That's why we use a systematic screening protocol, like the zigzag pattern you see here. You start at one corner, scan methodically across the field, move down, and scan back. You cover the entire cover slip, leaving no stone unturned. And this takes time. Look at the bar chart. We're talking a minimum of 10 minutes for a stool concentrate, and at least 15 minutes for a blood sample. The warning here is serious. Random viewing leads to parasite loss. It's probably the single easiest way to miss a low-level infection. Okay, we've nailed the how to process a sample and scan a slide. Now let's get into the what. What are we actually looking for? This brings us to section 3. Identifying parasitic life stages, focusing on protozoa, helminths, and blood parasites. When it comes to protozoa, we're on the hunt for two main life stages. On the left, you see the trophozoite. This is the active, motile, feeding stage. Finding these usually indicates an active, symptomatic infection. On the right, we have the cyst. This is the dormant, infective stage. It's got a tough, defined wall, and it's built for survival outside the host. Finding only cysts might mean the patient is a carrier or has a more chronic infection. Being able to tell these two apart is absolutely fundamental. With helminths or worms, we become investigators, looking at very specific features. For their eggs, we have 4 main diagnostic parameters we look at: the shape and size, the shell thickness, whether or not there's an operculum or a little cap, and the spine position. For larvae, we're examining their anatomy in detail, looking at the buccal cavity or mouth, the esophagus length,
and the specific shape of the tail. Each one of these features is a critical piece of the puzzle for identification. Now, for blood parasites like malaria or filaria, we use a really smart two-smear technique. The thick smear on the left is all about detection. We lyse or break open the red blood cells to concentrate any parasites into a smaller area, which makes them way easier to spot. Once we think we've found something, we switch to the thin smear on the right for confirmation. Here, the red blood cells are intact, which lets us see the parasite's morphology clearly and allows for a definitive species ID. To top it off, we calculate the parasite density using a specific formula, which helps us understand the severity of the infection. It's a really powerful system. All right, time for Section 4, Techniques for Advanced Accuracy. Because sometimes a simple look isn't enough. To be absolutely sure, we need to move beyond basic identification and use more advanced tools like staining and measurement. Think of specialized stains as highlighters that make certain features pop. Trichrome stain is fantastic for showing the nuclear detail in protozoa from stool samples. For blood parasites like malaria, GM stain is the gold standard. And for elusive organisms like Cryptosporidium, we use an acid-fast stain. Then there's micrometry, the precise measurement of an organism using a calibrated eyepiece. Why is this so important? Because some parasites look almost identical, and size can be the only thing that tells them apart. And as the slide says, this is critical. A size error isn't just a mistake, it equals a misdiagnosis. Now we have to talk about a major challenge, the look-alike trap. It's incredibly easy to mistake a harmless artifact for a parasite. A pollen grain can look a lot like a helminth egg. A starch cell might be confused with a protozoan cyst. A simple vegetable fiber can even masquerade as a larva. So how do you avoid this critical pitfall? You use the differentiation checklist. Ask yourself, does it have an organized internal structure or is it random? Does it have a nucleus? Is the wall regular and smooth or jagged? And, of course, does it show any independent motility? Running through this checklist is your best defense against making a false positive call.
And that brings us to our final section, reporting and quality control. Finding the parasite is one thing, but ensuring your findings are accurate, reliable, and communicated clearly is the final, essential piece of the puzzle. So let's talk about the lab report card. Our reports can't be subjective. We use a quantitative reporting scale: rare, few, moderate, many, so everyone is speaking the same language. For blood reports, we need to be even more specific. All of this is part of a larger system of quality assurance and control. We have internal QC, like having a second person review a slide, and external QC, like proficiency testing from an outside agency. The goal of all of this? Reproducibility. It means any trained analyst anywhere should be able to look at the same slide and get the same result. That's the hallmark of a high-quality lab. And here we are at the finish line. Diagnostic competence achieved. We've journeyed through the entire process, from that initial macroscopic screening all the way to a confirmed final report. It just goes to show that in parasitology, the microscope is truly only as accurate as the eye behind it. By mastering standard protocols, proper wet mount prep, accurate specimen ID, and thorough accuracy verification, we ensure we get the right answer for the patient.